actually see something from Thanksgiving. I'm more worried about what Thanksgiving is going to do in another 10 to 14 days.
Health professionals across the country waiting anxiously to see what comes in the aftermath of holiday travel and gatherings. Even if you traveled, local doctors say it's not too late to slow the spread. KCTV5's Angie Ricono joining us now this afternoon with a look at what doctors at the University of Kansas Health System are saying. So, Angie, what do they recommend someone do next if they didn't stay home for the holiday?
Well, they're hoping that you do some sort of self-quarantine. But of course, the CDC doesn't have any official guidelines. They aren't saying you must do this. What doctors are saying is if you want to support your community, you probably should stay home. You should do some self-quarantining because you just don't know who you expose yourself to. You have your normal bubble of people that you're around. But then, of course, if you traveled, you've got all of these extra people you aren't normally in contact with. So they're saying quarantine yourself for up to 14 days so you don't spread the virus. Now, some people are choosing to be tested, but doctors advise you can't really do that until a full week after your travel has ended. Doing it earlier, that's really pointless. Also, doctors discussed how all travel that we did, it's not all equal, and you need to stop and think about what your exposure level is.
Car travel is more likely safer than not because you are with people in your household or you are alone. You're going to be able to stop off and get gas. That's an outdoor thing. If you do need to go into the convenience store, that's going to be a quick trip. You should be wearing your mask. Any food you can get is probably going to be takeout or drive-through. So that is much safer than, say, going through an airport where you have so many people traveling.
Of course, those airports were packed, so doctors, of course, are very concerned about what could happen next. They're talking about that surge upon the surge. But Brad, like you said, it's going to take a while before we see things because it takes at least a week for infections. And then they say after that, then you start seeing the hospitalizations. So we're really looking at about 2 weeks before we see the full impact from holiday travel. Back to you.
Yeah, we'll keep our fingers crossed that we can help keep these numbers down. Angie, thank you.